So in light of National Sleep Awareness Week, I'm here to talk about sleep apnea. For those of you who don't know what sleep apnea is the repeated episodes in which susceptible patients actually have collapse of their airway. You can identify sleep apnea by simple things like snoring, but if you want to be a little more specific about it, you can use something called the Stop-Bang questionnaire. So Stop-Bang basically refers to 8 bulleted points of things that you can ask yourself and whether or not you have the potential to suffer from sleep apnea. S refers to snoring. T refers to tired during the day. O is observed pauses, so a bed partner has witnessed that you have pauses or gasping for air. And P is blood pressure that's been elevated. So if you're somebody who suffers from high blood pressure, that can be a clue. The bang part of this, B, is body mass index. So if your body mass index is greater than 35, and if you ever question what your body mass index is, you can just get online and just plug the numbers into a body mass index calculator. A refers to the age over 50. N refers to neck size. So if you're a male, a neck size of 17 inches. If you're a female, a neck size of 16 inches. And G refers to gender. So if you're a male, you got one strike against you already. So if you actually score 3 or more positive, that puts you at moderate risk. If you score up to 5+ positive, that puts you at high risk for sleep apnea, and you should be evaluated. And it's really important to consider sleep apnea because sleep apnea is not just about bad sleep and not just about bad sleep for your partner. It also has major health implications. It can affect heart disease and high blood pressure and stroke and diabetes, and the list goes on from there. When it comes to treatment for sleep apnea, there are a whole host of treatments. Typically, the first-line treatment is something called CPAP, or continuous positive airway pressure. This is a mask that people put on their face when they go to sleep at night. And CPAP is extremely effective, and it usually should be tried because it's so effective. One of the issues, however, is that CPAP doesn't always get well tolerated, so many of the patients don't like their CPAP. The good news is there are a lot of alternative treatments that can be considered for sleep apnea. The challenge is basically these treatments need to be individually chosen based on what actually is contributing to the patient's sleep apnea. So when somebody has sleep apnea, what happens is that every night when they go to sleep, their airway collapses. The problem is that what collapses and how it does so is unique. So our first goal when we consider alternative treatments is to try and discover what is happening to you. Our second goal is then to outline treatment solutions, and they can range from anything from what are called oral appliances, devices that sleep dentists can create for you that basically keep your airway open, to surgical intervention that can basically change the anatomy of your throat, and one of the newest and latest and greatest treatment options, which is something called Inspire therapy. This is an implanted device. What it does is actually acts to stimulate the nerve to your tongue to move the tongue forward, and when it does so, it actually opens up the entire airway. The device looks a little like this. This is typically an outpatient procedure for acceptable candidates, and it has had incredible success both in terms of the quality of sleep for patients as well as in terms of outcomes related to sleep apnea.